I'd like to ask your permission to use this video for educational purpose and on internet.
Yeah, that's fine.
So tell me about, first of all, about 2 months ago you had a surgery. We did a L5-S1 minimal invasive OLLIF procedure. What were your symptoms before that?
I had excruciating back pain right above my tailbone.
1 to 10, how bad would you call that back pain?
10.
10.
It was excruciating. I mean, I could barely, when it first happened, I could barely walk for
How
2
long
weeks.
did you have that symptom?
14 months.
14 months.
Until I got my surgery.
And then your surgery, where did you do the surgery?
I got L5-S1 fusion.
In what location?
That was at the Nera clinic on a Saturday surgery.
Yeah.
And I was...
it was a day surgery,
It
right?
was a day surgery.
How long after the surgery did you go home?
I walked 30 minutes after my surgery.
Okay,
I was up a little dazed, but I was walking 30 minutes after my surgery with a walker.
Let's talk about your back pain and leg pain. Right after the surgery, you had leg pain before the surgery?
Yes.
Right after the surgery, how was the leg pain?
I had pain in my left leg after surgery, which I was warned was going to happen. There was a 15% chance of that happening, and I got that, and that was really hard. It was throbbing leg pain 24/7, and that only lasted about 2 weeks, to the point where it was actual bearable leg pain after that.
And then, but before the surgery, you had some other leg pain?
Yes. Yep.
How was that? The one that had before the surgery?
Before the surgery, it was leg pain, but not as bad as the post-surgery leg pain. And then now I'm starting to have that leg pain again.
Okay.
And we think
but let's go a step back. So you had some leg pain before the surgery.
Yes.
After the surgery, you had a new leg pain on the left side.
Yes.
So you're staying very realistic. But the leg pain that you had before the surgery, right after the surgery, was that gone or?
Yes, that was gone.
That
100%.
was gone. Okay.
Yep.
So, and then the back pain. You obviously, right after the surgery, we do instrumentation and so on. How was the back pain?
That stab in my back that used to be there is completely gone now. Yup, that's completely gone.
I want to go one step back as well. We investigated your spine with a discogram, right? Can you describe how that discogram was and what the result was?
It was at 4 levels, my L2 through my S1, and I got an injection in all 4 of those levels, and the first 3 levels that they did, there was no pain at all, just a little increased pressure, and Dr. Schultz got 100% of the dye-in. And then he did my 4th level, and he got 40% of the dye-in, and I was screaming and crying on the table.
So,
and he said he's never given a more obvious discogram in his career. He apologized.
And that was proof that your problem is actually from the bottom disc, L5-S1.
Yes, L5-S1, yes.
At the same time as well, we investigated your sacroiliac joint. And I want to turn around here. Actually, maybe you can hold this in your hand. So your problem was this disc. And they did a discogram from here to here.
Yes.
This was very positive. But look at how close is this to sacroiliac joint. We did as well investigate the sacroiliac joint because of the proximity. Symptoms of the sacroiliac joint and the bottom disc are can be very, very similar. What was the result of that injection in the sacroiliac joint?
I had no relief of my pain from those 3 injections, but I also think that that's because I was in so much pain at that one spot where my disc was ruptured and sticking out. And so I really, when I got them, it basically just increased the pressure in that area and made me hurt a little worse.
Now, one of the things that happened is that, so after the surgery, you had a new left leg pain that got better 2 weeks later.
Yes.
And then the previous leg pain was gone, and the back pain, stabbing pain was gone. And so you got significantly better.
Yes.
Now, that was just 2 months ago.
Yes.
Spine doesn't heal in 2 months. So we still will have up and downs, and that's normal. Up and downs, people feel good, they want to do more, their body gives them pain, and then they stop, and then goes up and down. But something else happened. Your pain got worse. Tell me about it.
Yes, in the past week, it was after a physical therapy appointment.
And as well, chiropractic treatment, right?
No, chiropractic, that was a year ago.
Oh, I see.
Yup, that was right after I injured my back picking up the stack of wood. Yup. And no, it was just physical therapy, light work. mostly just muscle tissue massages to try to loosen me up, and then very minor at-home activities. And I was just walking, and all of a sudden I started to get a stabbing pain on my right hip.
In the hip.
And the hip is where it started, and then it started going all the way down my legs, up my
the back
feet,
of the leg?
back of my legs, side. I've had it in my
Groin.
front of my groin, going over my foot, and it almost feels at times it's like I have icy hot running down just a certain spot of my leg.
Yeah, I'm going to turn around here again and show that, your incision for your spine are here and here. When I ask you to show it on your back, you are about 2.5, 3 inches below that. You're literally pointing to this.
Yup.
And guess what? The other side of this joint is your groin. And do you see those nerves here and here?
Yup.
These are the nerves you just described where they go in your legs. And in a real person, that nerve is not cut. It goes right over that joint right there. And irritation of the sacroiliac joint can irritate the nerve and cause this kind of problem. We provoked your sacroiliac joint. I'm not going to do it anymore. But what did I ask you to do?
I put my knee up.
Yeah, on
like
the other
this,
side, obviously.
And we pushed down, but it was this side.
That it was.
Even just having it up right now, I have increased pain here.
Yeah, and that is a typical sign of sacroiliac joint problem, because that's a provoking sacroiliac joint. Now, we talked about what we are going to do for that joint. Now, first of all, statistic. 43% of the people who have spine problem in the lower spine and with the fusion end up having as well sacroiliac joint problem. Doesn't mean all of them need surgery, but that is a common problem. The same way that people who have knee problem have hip problem. Same kind of forces, situation that damage one, damage the other one. And the good news is many of them with some steroid injection improve. So, and we talked about that, that's our plan, to do steroid injection in sacroiliac joint. But we talked about that's the therapeutic part of this side joint injection. We talked about as well the diagnostic part. What did I tell you and what do you remember? What the diagnostic part look like? That I numb it up?
Yeah, we're gonna do two rounds of shots at both of my sacroiliacs on each side, and numb it up, and hopefully within half a day, the pain has gone away.
Well, for half a day.
For half a day. Okay.
Meaning because what I do, I put numb it up like the dentist numb it up.
Oh, I get it.
Yeah.
Yep.
So practically we numb it up to see if while numb pain is gone. If that's the case, we are sure that's a problem, that's the diagnostic part, but the steroid that I put in start working within 5 to 7 days and then start actually fixing the problem. So half of the people are actually good with just injections. The other half, we have to do more. Now, having said that, in your situation, we know lots of people after lumbar fusion that stress out sacroiliac joint, and that temporarily it goes away. But other half, we have to do additional steps. Now, that was actually, I think, for many of our patients that you have your problem, it's very educational. What do you want yourself before this visit know? What are the other information that you want to pass on to your previous self if you'd go back in time a week?
I would say, don't be stubborn about going to the doctor. Don't just think you have a little pinched nerve or you might be sore. Go get checked. I really wish I would have got checked the second I hurt myself, but I tried to go the less invasive route and do chiropractic care and try to just ice and stuff, and nothing helped, and it turned out I had a very ruptured disc. So I would just say go see a back doctor, actually. Don't just go also to your medical center. I would go see a back doctor.
Yeah. A spine specialist.
Spine specialist.
Yes.
Especially a place like this.
Good advice.
Yes. They listen to you here, actually, compared to a medical center. I didn't feel like they listened to me at any of the other doctors I went to.
Yeah. And I think another thing what I would recommend to everybody is go online. There's lots of information you can get. Okay. And that is this is 2022. There's a lots of valid information you can get online. Now, regarding your current problem. I think there is a very good chance with few sacroiliac joint injection we can solve that problem. Another thing that I think I tell everybody need to know is you will have good days and you will have bad days. If you do more, your body give you a signal that is too much.
Yep.
And that signal for our body is always pain because we don't listen to anything else. And so I think your body is talking to you. And you told me that after you significantly reduce your activity, describe what happened.
It feels better. I'm not
Good.
as flared up as I was. 7 days ago, I could barely, the second I got out of bed, I was in pain. And now when I get out of bed, today was the first morning I actually got out of bed with no pain.
Good.
But as I start walking, I start to feel it again.
Yeah, and that is practically your body telling you what your threshold is, and that sort of tunes your activity to be increased as your body's ready for that. Okay. Well, thank you so much. That was very educational. Okay, thank you.